morning, everyone. And thank you for inviting me to speak at this incredible forum focused on health and health equity, one of my favorite topics and lifetime of work dedicated to it. By way of introduction, I'm Kulleni Gebreyes, and I serve wearing two hats at Deloitte, which is I'm the National Healthcare Consulting Leader, and I'm the leader of the inaugural Deloitte Health Equity Institute. So before we go any further into the session, given that we are talking about definitions and data, I want to start by defining how we think about the future of health, what health is, and that will help us frame the conversation that we're going to have. So in the future of health, we believe that you require a mental model for health and well-being, especially when you're discussing women's health and health equity, that includes aspects of physical, mental, emotional, spiritual, and social well-being. We also define health equity as the fair and just opportunity for everyone to fulfill their human potential in all aspects of health and well-being. So when you talk about it that way, it's obvious and apparent that health and health equity are extended beyond clinical care and, quite frankly, even beyond healthcare. This mental model is the gateway to understanding the importance, the interplay, and the interdependency of those factors, including clinical care, but the social, economic, and environmental factors that impact our well-being. Now, you don't have to take my word for it. There's lots of data that supports this. Many of us have seen the data that estimate that medical care is responsible for only 10 to 15% of preventable mortality in the US. In fact, in terms of life expectancy, estimates have found that half of all deaths in the US include behavioral causes. So what does that mean? Does that mean it's an individual responsibility only? And the answer to that is absolutely not. What this means is, as we think about health and well-being, the barriers that individuals and communities face to achieving their full potential includes three core root causes that we will dive into today. First root cause I would identify is racism and bias. Racism and bias exist within and outside of the healthcare system, impact outcomes. Structural flaws in how care is delivered and how care is financed. So decisions we've made in the past, decisions we continue to make that impact health and well-being. And then last but certainly not least are the deep inequities in the drivers of health, what many refer to as the social determinants of health. I'll start with giving you the spoiler alert on this 10-minute session, which is really to say that we strongly believe health and well-being should be accessible to all and for all, and that health equity is a moral imperative that requires a business solution. Now let's jump into a picture I like to share with folks when we talk about drivers of health. If we can show that first slide. So the term drivers of health, which I mentioned, is a term that many refer to as social determinants of health, is really focused on three key things. But I want to share why I choose to use the term drivers of health instead of social determinants of health. Is I want to put in your mind that these factors are not deterministic, but rather highlight opportunities for interventions that we can take in order to improve health outcomes and health and well-being. And so as you think about the drivers of health, the three categories are environmental, economic, and social. Within each of these drivers, you can take different slices to understand the multiplier impact that each one of these can have, in addition to the intersection of race, gender, sexual orientation, income, geography. Now let's start with the environmental drivers of health. The green section contains food, infrastructure, and physical. When you look at the last year during the pandemic, LGBTQ adults living in the US are 2 times more likely to have experienced food insecurity. When you think about breast cancer and pollution, about 1 in 8 US women will develop invasive breast cancer. But women that have been exposed to higher levels of air pollution have a 30% increase of developing breast cancer. Climate change and air pollution are not just associated with $800 billion of healthcare costs annually, but burning fossil fuels releases microscopic soot particle pollution, and breathing this results in cardiovascular and respiratory ailments that impact over 100,000 premature deaths in the US. So that's just the environmental piece, and there's a lot more data around that. Let's jump to the economic. That's the blue section that you see. When you talk about poverty, families with single women as heads of households at 23% in poverty in 2019, as opposed to 11% of single families led by single men. When you think about wage equity, we have women earning, more than 500 billion less than their male counterparts for the similar jobs. Now, what's interesting here is that obesity rates and poverty are highly correlated. Women who are in the low income status and below the federal poverty line have over 30% higher obesity rates compared to those with incomes that are above the federal poverty line. Heart attacks and poverty are also related. Adults who live in poverty have greater risk for dying at a younger age. In fact, this is not just at a single instance in time, but when you think about post-hospitalization, those who meet the criteria for being economically disadvantaged are much more likely to die than those that are not. So that's the economic component. Let's transition to the social drivers of health, which is the teal section, includes safety, connection, and education. Now, one in three women will experience some type of violence at the hands of a partner. And that obviously leads to poor outcomes. But in addition to that, there's data that shows that social isolation really impacts the risk of dementia, and poor social relationships characterized by loneliness is also correlated with a 30% increase in heart disease and 32% increase of stroke. Now, I share all this not to burden you with how big the order of magnitude of these challenges are, but to say that it's critical for us to understand that these drivers of health or social determinants of health have a real and measurable impact on health and well-being. Now, before I transition to the so what, I do also want to highlight that while all these drivers of health have an independent factor, there are health inequities and health disparities, including maternal mortality, where Black, American, Indian, and Alaska Native women are 2 to 3 more times likely to die from pregnancy-related causes than white women, even when you adjust for all these drivers of health. And so what's important to realize is each of these have an independent and interdependent factor, and that we as a society, we as a healthcare system, we as a country must address. So I'll take you to the next page, which says, oh my gosh, okay, we understand the problem, but what's the economic impact, and how can a single organization really take action against these things? Because, it costs too much. So what I will agree with is that disparities cost the US in excess of $90 billion of medical costs a year. And if you think about data that shows that if we were to just eliminate race-based disparities within the healthcare system, we would, increase economic output by $2.7 trillion annually, which is pretty much what we spend in healthcare today. As part of understanding what healthcare organizations are doing, Deloitte actually did a study on the drivers of health to say, what are healthcare leaders doing? What are they thinking about? We identified 3 key insights I want to share with you today. One thing we learned is that most healthcare organizations are screening patients much more than they were 3 to 5 years ago. However, while 80% of healthcare organizations screen to determine what access is needed, only 35% have established community partnerships to actually identify those areas or to address those needs that have been identified. In addition, we saw that value-based care has been adopted much more greatly, and 20% of healthcare leaders in 2017 said they've actually included driver of health initiatives and programs within their value-based models. And by 2021, this had increased to 58%. So this is a great movement. But an area of greater need that still continues to need to be addressed is that very few healthcare organizations focus on their own employees and understanding what they're struggling with. And I think this is an opportunity that we all have to address this. In fact, we found out that, as you screen employees, it's up to 40% to say they have trouble paying their bills or paying for food. And so I think this is really important for us to keep in mind. But what do we do about this? This is so big and so challenging. Now, we believe a data-driven approach is most impactful in addressing drivers of health. We believe that organizations need to look at both an understanding of which of their communities, which of their populations are impacted, and then not just doing this as part of community benefit or mission, but actually addressing these core causes with the business strategy and making it a new basis for competition. So I'll give you a few examples in the slide that we have. And so as you look at column one, and if we can pull the slide up, is saying like, how big are these challenges and understanding that disparity? Column two focuses on how do these disparities actually impact health outcomes? Three looks at what's the business impact? And then kind of closing it off with, if we were to address this, what would happen and how do we actually make a difference? And so what I get excited about as we work through all of this is really knowing that, you know what, doing the right thing is actually good for business. So you see, I'll give two of the examples, which is COVID, higher rate of hospitalization for those who are in poverty, higher rate of mortality for communities of color. Now, this is not just a moral imperative, but there's an actual real savings that can be achieved if we can avoid these hospitalizations. Same with hypertension, same with infant health. And so when you as healthcare leaders think about what are the disparities that impact my population, my employees, want to call on all of you to really think about aligning business and profit. I invite you to also work with us at Deloitte Health Equity Institute, which is our social innovation and knowledge development organization. And we are committed to advancing health as an outcome. And really to say that we believe that we are in business just like you. We are in a business where we employ people. We are taxpayers. We are individuals who take care of our families. And therefore, health and health equity are vital for all of us. In closing, I'll give a quote, since I saw Mike Dowling also give a quote, which is one of my favorites by Maya Angelou. It says, "Do the best you can until you know better. And then when you know better, do better." I invite you all to join us on this journey to advancing health equity as an outcome.